A little-known respiratory virus, which causes symptoms similar to the flu and COVID, has spiked across the nation, according to the CDC. It's called HMPV, and it has also led to hospitalizations among many of the most vulnerable, including young children and seniors. So what are we seeing here in the Valley? I spoke today with the medical director of Eisenhower Health's Tennessee Emergency Department, Dr. Eutham Contaxis. Dr. Contaxis, first off, what is HMPV and why is it so concerning?
Well, the H stands for human, and the virus is called a metapneumovirus. So it's HMPV because it's a little bit of a mouthful. But the virus itself is a lot like RSV. It's in the same kind of general class of viruses as RSV. And so what happens is it's just basically an upper respiratory infection, like a cold, but then it settles in the lungs and can give you some pretty significant pulmonary issues like RSV does. Particularly vulnerable are young children and older patients. It's not a virus that we have any kind of vaccine for. And as you know, in viruses, they tend, just like flu viruses, they tend to mutate. So vaccines require constant upgrading and changing in order to be effective. So we haven't seen a whole lot. It usually occurs late winter or midwinter to late winter and goes into the spring, whereas you'll see RSV maybe in the fall, into the winter, and sometimes a little longer. And we've been able to detect these viruses a little more accurately because the testing is better now. So, for example, there are tests that can show us 20 different viruses, including coronavirus, including RSV, influenza, a whole list of them. This helps us determine in some high-risk patients what we can do to support them, or whether this is a virus that might be amenable to some therapy. There are some therapies for certain viruses.
So basically, if a patient comes in with respiratory issues, which obviously could be the flu or COVID or RSV, you are able to do testing for all of those viruses at one time?
If needed. So on certain, these tests take a while and there's limited availability. All that, we run out sometimes because there's a demand for them. So we try to do it in patients where it's going to make a difference in our decision making.
And you mentioned it sounds like we've not had many cases here in the Coachella Valley that you know of.
No.
But are you concerned we will see a spike compared to other parts of the country? And if so, how dangerous is this virus?
Well, I think we saw a spike of some viruses in February, March, which is our spring. But now we're getting into the summer months, and I think there's been a drop-off in terms of these kind of winter, spring, fall, upper respiratory infections. And we'll see other kinds of viruses, maybe some ones that cause diarrhea, enterovirus, or some summer viruses that we see sometimes.
But the bottom line, how concerned should people be about HMPV?
I think because it has a name, it increases your concern, but we call it, we have a general catchphrase, oh, I think I have a virus. It's the same thing for most people. It's only if you have risk factors that you should be more aware, consider testing to see if it's a virus that needs some sort of an intervention. And most of the time, people do just fine with these.
All right, Dr. Contaxis, we appreciate your time. Thanks so much for joining us.
Thanks. Have a great day, Peter. Talk to you later.